evening and welcome to the People's Pulse. I'm your host, Natalie Nelson-Tango. Thank you so much for joining us once again for another edition of the People's Pulse. I have some very special guests this evening because I want to talk about healthy lifestyles. You know, if you live in the Virgin Islands, that's one of the things that we really need to continue to work on. Joining me to discuss the topic, I have Dr. Walter Gardner, a local physician here in the territory and owner of the Caribbean Kidney Center, and a visitor from Gainesville, Florida, Ms. Stephanie Pollard, Master's in Public Health Administration. Mm-hmm. Welcome, and welcome to our beautiful island. And just briefly, Stephanie and I met online because Stephanie does a lot of health topics in her area in Gainesville, Florida, where we actually both went to the University of Florida, and she wanted to come to the Virgin Islands and share her information with us. And welcome.
Thank you.
And of course, I wanted to do a two-part series, and I wanted to focus on men's health because, you know, sometimes our men tend to shy away from health issues. So I was very glad that they joined me this evening, and I'll have a second part with some other doctors to follow. But tell us a little bit, first of all, I'll start with Stephanie because you've been doing this quite some time now, Stephanie. Why have you even chosen this field?
Well, for one, I've worked as a laboratory technologist for the past 24 years.
What's the name of that?
A laboratory technologist.
Okay, got it.
Mm-hmm. And in that field, we do mostly laboratory tests, so sometimes you don't always get to talk with the patients, but you see these results. And so I had an opportunity at a clinic to be able to have some hands-on conversations with patients and saw that they had questions about their laboratory work, and I wanted to be able to give more information on that. And so going back and getting my master's in public health allowed me an opportunity to go to communities and be able to give them information on diseases, on nutrition, on exercise, and sometimes answer questions that they may have that they haven't asked their physician.
Right, and that's key because a lot of times, we go to a physician and we listen and we don't, for whatever reason, don't tend to ask the questions that probably need to be asked so that you can know, why am I taking this medication, doctor? Why do I have to do this treatment for this long? You know, we tend to shy away from that as well. And so in your area, tell us a little bit about what you do.
Well, I'm a nephrologist. And at the Kidney Center, we, well, first of all, kidney disease is really epidemic proportions in the
territory?
Yes.
Really?
And we have made it accepted the challenge to try to educate as many people as possible so that we can hopefully decrease the number of patients with kidney disease and ultimately dialysis.
And those patients you treat are on dialysis?
No, I do more than that.
Okay, tell us a little bit.
First of all, I do general internal medicine, which really is sort of limited to high blood pressure and diabetes care in my office.
Okay.
These are the two big causes of kidney disease in the territory.
I see.
And diabetes because of the epidemic of obesity that we now have, not just in the territory, not just in the United States, but worldwide, quite frankly. And high blood pressure, which is a very common disease in the black population.
Right.
These are the two causes of kidney disease, and we try
kidney failure,
and we try to educate patients as to how to treat these, what the importance of treatment is, et cetera, et cetera. And then only after that would we get into the dialysis patients and those people who have failed.
Got it. And as I'm listening to you, I think that you would agree that prevention is better than treatment,
Absolutely.
right? So
Absolutely.
that's why I said healthy lifestyle, because it goes back to the way we live, the things we eat, the nutrition, the diet, the exercise, et cetera, et cetera. But we were talking before we came on the air, does high blood pressure mean you're going to get diabetes, or does diabetes mean you're going to get blood pressure, or neither?
Okay. Diabetes almost inevitably
you eventually
develop high blood pressure as part of the process. It's not the opposite is not true.
Okay.
If you have hypertension,
you
doesn't necessarily mean you have to.
Is diabetes genetic? Does it mean like
yes.
if it runs? It
yes,
is?
exactly.
High blood pressure too?
High blood pressure, yes, to a certain extent.
Yeah.
There are non-genetic causes of hypertension, correctable causes, which are very rare, but as physicians we are compelled to look for those and treat them when we can.
Okay. And where men are concerned in that particular thing, Stephanie was saying of course, we have the old saying for men, if it's not broken, then don't fix it. And I think, you know, we have some situations you have habit and you tend to shy away. Doctor, in treating patients, I guess you see men, women, children, the whole...
Well, I don't see very many children. Okay, very rarely.
Very
do I see
rare children,
yes.
okay. So men and women, is it an even amount, would you say, or do we have more men than women? Because as we were talking earlier, Stephanie said that the Journal of the American Heart Association did a study, and they said that teenage boys are more likely than girls to develop high blood pressure in early adulthood, and some other statistics that they did. Do you see more of which sex, or is it
Well,
even?
I think my practice, and generally speaking, my practice is about equal in both men and women.
Men and women.
I think the women are much more conscientious about the health concerns than men are, or men tends to be much more macho.
Yeah.
But we have enough.
Of both.
We are becoming, people are becoming more sophisticated and more concerned about healthcare, both men and women.
Are they knowledgeable though? For example, the person's on dialysis. Are they knowledgeable about what that treatment is, what it means for their body? Do you find them to be knowledgeable, or are they just going through the process and leaving it all up to the doctor?
Well, that's a good question. Let me answer it this way. It's our responsibility as physicians, as healthcare professionals, to educate our patients in their disease processes and treatment processes. One of the characteristics of the patients in the Virgin Islands is an incredible avoidance, denial when it comes to dialysis, kidney disease and dialysis.
Really?
And there are we can relate several instances where patients are told that they've got kidney disease, and they will literally disappear from you.
What do you mean disappear from you?
Literally disappear. You tell them, look, you're going to be needing dialysis. These are the things you need to do to prepare yourself for that treatment modality. And they just disappear. They never come back to see you.
Oh, my goodness.
Until sometime they present themselves in the emergency room very, very ill, and that's the next time you see them.
Wow.
We've tried, I think that's a reflection of a lack of education in terms of what kidney disease is and what dialysis is.
Well, tell us in a nutshell, doctor, what is kidney disease?
Okay. Well, kidney disease is when your kidneys are not working well.
Okay.
Now, your kidneys do a variety of things.
Okay.
We won't necessarily go into all of them right now, but suffice it to say that your kidneys eliminate the poisons that your body generally generates.
Okay. So it rids your body of toxins and whatever we produce on a daily basis.
On a regular, daily basis, on an ongoing basis.
On an ongoing basis. Okay.
Now, when your kidneys are not working well, these toxins tend to accumulate, and they eventually make you ill. In addition to which, your kidneys also regulate the fluids in your body. And when the kidneys aren't working well, you tend not to regulate fluids, and that's one of the reasons why you get swelling and this sort of thing.
I see.
Now, it's a very positive thing that we have dialysis to offer to those patients. And instead of running away from it, patients should embrace it, try to understand it, because it does make a difference in your life. And we try to educate and inform our patients what dialysis is, so it's not as fearful as it appears to be, generally speaking. And that's our challenge.
Let me just ask you really briefly, because I have a question for Stephanie. Is dialysis painful?
No.
It's not. What about it to be?
Let me qualify that though. To do dialysis, you have to take blood out of the body, and you put it back into the body. So it means insertion of 2 needles. Obviously, inserting 2 needles into your arm is going to hurt a little bit.
Right.
It's a temporary pain. While the process itself is painless.
Oh, so the pain is just why you put, just like if you're getting
take an IV or something.
An IV or a shot or when drawing blood, like that.
Correct. Exactly.
Okay. Well, Stephanie, on your end, in Florida, what has been your observations with the patients?
Very similar to what you see here.
Again, that tells us a lot of times there are more similarities than differences, regardless of where the jurisdiction is. So in Florida, you're in Gainesville, right?
Yeah, I'm in Gainesville, and it's very similar because many times when I go out into the community and talk about these, especially diabetes and heart disease, and sometimes I offer to do blood pressure screenings, and patients already, well, we can't call them patients then, but the participants already know many times that they have high blood pressure, or we also offer blood sugar screenings, and many times they will have known that their blood sugar has been elevated and have been told by their physician to come back in to get medications to treat it.
But they choose not to do.
And they choose not to. And what I hear too many times is that they think they'll go home and take care of themselves. And many times, it's not that one time that it's come up. It's been going on
for a while.
So
does that mean, like what the doctor was just saying, that eventually when they resurface, it's probably at a pretty dangerous stage
level, yeah, because a lot of times when we get in the hospital, we get patients that have collapsed at home or just had a bad headache and come in. One of the first things we do is we do a whole panel of lab work, and so we'll get blood sugars of 500, 600, 700, 800.
Wow. That's high, isn't it?
Yeah. I mean, even when I worked at the women's clinic, we had a young lady come in. She said, I just don't feel good. Her blood sugar was 750.
Wow.
And, I mean, you have to take care of that. I mean, that's dangerous.
Sure.
I mean, you have to go in the hospital when that happens.
Now, does kidney disease, obviously the health field is not my field. We spoke about that when we were driving, right? But does kidney disease lead to kidney cancer?
No.
Okay.
No. Kidney cancer is like any other cancer.
Does it lead to bladder cancer?
No.
Because, by the way, July is Bladder Cancer Month for you. You know, are they tied? You see what I'm saying? Or one doesn't have anything to do with the other?
One may not necessarily have anything to do with the other.
Or do you have a greater risk of getting kidney cancer because you have kidney disease?
No. That's not true either.
Just ask.
I understand.
The viewers are going to call and they're going to have their own questions, but I'm just curious.
No, look. Cancer is a whole different ballgame, and any organ, you can get cancer of almost any organ. Now, kidney cancer is certainly one of the possible cancers. Bladder cancer also. The things that tend to cause kidney and bladder cancer do not necessarily cause kidney disease per se.
I see. I see.
Smoking. Dyes, in addition to dyes, this sort of thing, can cause cancer of both bladder and kidney. But that's a different area. Okay. And the urologists are the ones that usually deal with that much more than the nephrologists do, although we diagnose it and refer them
and then you refer them to that specialist, so to speak. Okay, and for the other part of my series for men's health, I'm going to have Dr. Graham. Dr.
Graham is a urologist here.
He's a urologist
Very good urologist.
Okay. Got it. We're going to try and work on that as well. But I really wanted, the reason why I put the spin on with the men's health is because our men are, like you said, kind of macho, and they are, but they need to know to go in and get these health screenings. You were talking about your physicals. Why are you saying that that's so important?
Well, annual physicals, at that time, they can do a lot of tests. They can screen and see if anything's wrong. And one particular test that is very easy to do is a urinalysis. It almost gives a good indicator as to what's going on inside your body. And so it's going to check blood sugar, it's going to have protein, it's got white blood cells, red blood cells, they can see how much bacteria is in there. All of those things can give a good indicator as to what's going on inside your body, in addition to having some blood tests done too. And then at certain ages, they need additional tests like the prostate test, the mammogram, pap smears, and those tests. And so, pap smear and mammograms for the women.
But for the men,
because
I really want to focus. The reason why I want to focus, for example, the prostate was a problem. Most guys didn't want to do that prostate test. And you know why? I guess it was an anal rectum type.
It's what they call a digital,
whatever it was. And guys were like, I ain't doing it. Now it's a blood test, if I understand correctly. You can have a blood test, and you can get that, and you can have your prostate checked.
You still need to do the digital exam as well. You
Doctor?
You do both.
Oh, goodness.
You do both.
So you still, or is it recommended that you do both, but you don't have to do both?
It's recommended that you do both, and you should do both.
And you should do. Why? Why can't they just do the blood test and get the results?
Because the blood test is not foolproof. You can have false negatives and you can have false positives.
Oh.
Number one. Number two, if you do a digital exam, what you're actually doing is you're actually feeling the prostate.
So and that you can tell if it's enlarged or whatever?
Well, the consistency, the size of it, I mean, if it's nodular and hard, it suggests one thing as opposed to if it's nice and normal feeling. It could be large because it's just enlarged and without cancer. Right. And it could be enlarged because it has cancer in it. Oh. And the digital examination, as uncomfortable as it is it's like having colonoscopy. I mean, it's all these things have to be done. They're not comfortable.
Because I think when you get a certain age, 40, 45, something, you got to have your first colonoscopy,
right.
And that can be I understand it. You drink something and it blows you out, something like that. What was explained to me is that you drink some fluid all night long, and it extends.
No.
Okay.
You drink fluid all night long to get cleaned out.
Okay.
So that when we look in there, we can see what's going on. We're not obscured by all the other stuff.
All of stuff. Yeah. So it empties out.
Empties out.
I stand corrected. But we do the colonoscopy so that they get a better picture of it. Because I understand that once that's done, if there are any polyps, is that what it's called?
Right.
They can
take those out.
Take those off at that time. If it's I think at a small size and in an area where they can reach it. And if not, then they do a surgical procedure separately to remove it, or they recommend that you do, because my understanding is that the polyps over a period of time, 10 years, whatever, can become cancer. They don't have to, but they can become cancerous.
Colonoscopy, you go all through the entire colon. So if there's any polyps anywhere in the colon, it could be removed.
You can remove it at that point.
Right. And like you said, they're precancerous lesions and therefore need to be removed.
Right.
And of course, they could also biopsy any lesions that are not polyps but look like cancer. And
just take it out to be safe.
Yeah.
Okay. And that's one that we tend to do. Going back to the other one that we talked about for the men that you said digital. And that is the most curable cancer, I understand, if it's
prostate cancer is
detected early on.
If detected early, let me make an admission here. I'm both a prostate and a colon cancer survivor.
Oh, good for you, doctor. Wow.
So I know a little bit of what you speak.
Okay, so tell us, enlighten us. Is it in fact the most curable in the fact that if you get it early enough, because of doing what Stephanie just said, and I call her Steph, Steph was saying that if you do these annual physicals and get these things done on a regular, checked on a regular basis, you can pick it up early enough to say, okay, let's just take it out or whatever.
That is correct. And I owe my presence here tonight to that fact. Unfortunately, my father died of colon cancer. Oh. So I knew that he was.
He had that
in my
potential.
family.
Is it, doctor, then, if you have that you have to do it earlier, so you would have do your colonoscopy?
I started doing colonoscopy every year since I was age 40.
Wow.
I will tell you how old I am now. But
Okay, gotcha.
And fortunately, we found the cancer at a very early stage, and I had my part of my colon resected.
So that's the other thing, you can do that, right? You could just take out that part of the colon or whatever it is.
Depending on the location.
Okay.
The location is very important. It would determine whether you what surgery you do and whether you have to have a bag or whether you don't have to have a bag.
I see. Yeah. Okay.
And so it's again getting back to the theme of the program. It emphasizes the need for regular checkups, annual checkups, and doing all the screenings and everything else. Similarly with my prostate, and this is a classic example of what you're talking about. My PSA was normal.
PSA meaning
PSA is the test that you
blood
do.
Test.
Yeah, it's blood test that you do.
And normal meaning, what's the range there?
Okay, your PSA is supposed to be less than 4.
Yeah. Less than 4 under 4.
Yes, 4. Okay. And my PSA was less than 1 initially, and a year later it had almost tripled. Although it was still not 4. And my internist was astute enough to suggest that we do a biopsy, so that and I was totally without symptoms. And
is it usually symptomless?
No, it's not. It's not usually. You usually have
Some
as your prostate enlarges, it blocks your urine flow, and you have difficulty voiding.
Okay.
But in my situation, for example, it had not gotten that big apparently because I was totally symptom-free.
Right.
Totally asymptomatic. And we did a biopsy. And in fact, my biopsy was done in the States, and I came home because I was absolutely confident it was going to be negative.
Yes.
And I was sitting by my pool one day and got a phone call and said, your biopsy was positive.
So in a case like that, they would do a retest.
No, if your biopsy is positive, you
But you said there's false positives and false negatives,
No.
so won't you go get a second opinion?
False positive blood test. That's why the digital is also important.
I see.
Because it's quite possible, I don't do my digital myself, but it's quite possible that if a digital exam was done, they might have felt something that might have even given them a better clue. And quite frankly, it's quite possible that was what prompted my internist to suggest
what
I
he
do the
did.
biopsy.
And fortunate for you, you had an internist who had that foresight to decide, you know what, even though it's not
Normal.
even though it's normal,
Yes.
it's not above the range, let's get this done.
Yes, because it had increased substantially over the course of 1 year, which again emphasizes the need for having annual physicals,
The annual
so that you can
physicals.
track trends.
Okay.
Yes.
So just to kind of summarize to husbands, brothers, fathers, uncles, sons, you got to get this done. It could save your life. And those of us women in your lives need to get you to go with you, do what it takes, right?
Absolutely.
Because it's a matter of life and death.
Another thing, prostate cancer is almost epidemic in the black population.
Yes.
So that's another reason why I was at increased risk, and that was one of the reasons why I was sent to have a biopsy.
Do you see that in Gainesville too?
Well, Gainesville actually is one of the highest number of African American men there that have prostate cancer in the surrounding cities, and that's why we began awareness and prevention. What we call it, a advisory board, and we're going to have a national prostate cancer fair for the men on September the 11th, and up until that time, we're doing smaller group sessions with them, as we did on Tuesday, because it's such a high rate, and especially amongst our African American men.
Wow.
And we just don't have them going to the physician and getting regular checkups like they should. And then the other side of that, what I've seen is, like the doctor was saying, they'll get a result and then they don't come back and go, for the follow-up.
Well, maybe that fear factor to not have to hear what they have to say. Because this is kind of off the topic, but I heard some people say, well, you know what? I ain't taking no AIDS test. If I got it, I don't want to know. Now, that kind of is a selfish take on it, because, it's just selfish.
It
but
is.
you're better off to know.
Yes.
Because then at least you know what you're dealing with, and then you can address it.
And that's where, again, education comes in. I think the reason people don't want to know is because if you were able to explain to them, look, these are the options you have. These are the things that can be done. These are the things that should be done. And of course, the choice is theirs.
Yeah.
But they need to at least listen to what the options are and make a decision about it. Now, if he chooses not to do anything, having been informed as to what the potential consequences are, then that's his choice, or her choice.
Right.
And what I try to stress to patients, well, I keep saying patients, but to the community, is that cancer doesn't mean death.
Precisely.
And so many times that's what they have stuck in their mind, that when they hear cancer, they hear death. And the session...
Well, that can be a very, very potent news to get.
Yeah, but we have so much technology now. We've gone so far in technology now that we can take care of these things very well. And I know people that have had cancer and had to take minimal time off from work and disrupt their lifestyle, very minimal. Because we have so many things that you can do now. If we catch it early, it doesn't have to be like that.
But unfortunately, though, they're like the doctor said, there are any body part that can pretty much get cancer, but there's some that there's just no symptoms.
Yeah.
So this person could be doing everything right, getting their is that not?
Yeah,
that could be the case. Doing everything right, getting their annuals, eating a healthy exercise diet, and bam. I mean, just recently I saw a friend and mentioned to me that the aunt, who was fine all along, dropped down one day, and they took her to the doctor, then took her to another doctor, and 2 months later she was dead. She had been diagnosed with cancer, leukemia, and there was nothing they could do for her. So that tells me that it had already gone to a stage where by the time she became ill.
Well, now we have to go back and see where she's getting any annual physicals, where she going.
Right, well, that's true. Those facts are missing.
Yeah, because
Yes.
I do know, and having worked in the laboratory for 24 years, even though all lab tests are not foolproof, if you're going regular, we can see some things. And just like the doctor said, even though his was under 4, the physician saw that it was rising threefold.
At a rapid level.
And that's one of the points that Dr. Gilbert brought out at the session we had on Tuesday, that even if the result is less than 4, they look at if it's doubling or tripling, because that means that something is going on. So, but you have no way of knowing that if you only go one time and you never go back until 5 years.
Exactly.
And something happens.
What you were saying, Steph, is that some of the questions that the men ended up loosening up and asking questions, and it's questions that I guess you thought, well, you would know this, right? You thought that they would know, and they didn't know it.
Yes, because unfortunately, sometimes they don't get educated about the disease, about the treatment that's going to take place, because in healthcare, a lot of times they only have 15, 20 minutes sometimes.
You mean in the doctor's office? So you know what you got to do? Write your list. So go in with your list. Dr. Gardner, this is my list. I want to know this, I want to know this, I want to know that.
They actually do that.
They do it, you know? Okay.
And I think most physicians are sensitive to the patient's needs and would spend whatever time is appropriate. Now, obviously, if you don't ask questions, you may not get the answers you're looking for. But I think most physicians that I'm aware of spend a lot of time with their patients, explaining and educating them. The emphasis, especially in nephrology, is educating the patient as to what his disease process is and what you're going to do about it and why you do what you do.
Okay, and I want to go back to promoting healthy lifestyles, because we got to talk about that, because I do believe prevention is better than the treatment. But let's go back before that to the signs. How does a person know that they have a kidney problem or a kidney disease or whatever you call it? You know, what are the symptoms? How do they?
Well,
figure this?
if you wait for it to have symptoms, it's going to be. If you're waiting for symptoms, it's going to be too late when you find out.
Really?
Generally speaking.
Okay.
As Steph pointed out earlier, if you do an annual physical, you're going to get a urinalysis, which is going to tell you whether there's blood in your urine, which may be a harbinger of cancer or early sign of cancer, early sign of kidney disease of some other kind, lupus or whatever, what have you. So that is one way to find out early. If you have, you're also going to get blood tests done, and most routine blood tests are going to give you some sense of what your kidney function is. And recently, laboratories are now giving you your kidney function in terms of percentage of kidney function, what we call GFR, estimated GFR. So that a routine physical with routine lab tests done regularly should pick up early signs and evidence of kidney disease or any disease, most of the disease as well. And the physician could then make a referral if that's appropriate, or begin treatment if that's appropriate, or what have you. Obviously, if you're hypertensive or if you have diabetes, then you know that your chances of developing kidney disease is higher, and you need to probably be checking yourself regularly, and then certainly the annual physical is the way to go to begin with.
Okay. I think we have 1 or 2 photos that we wanted to share that shows the kidneys, because and I guess the guys can put it up on the screen at some point. They'll tell me when it's up, because I wouldn't know when it's up. But nonetheless, it kind of shows us a picture of the kidney and those portions. The renal pelvis. What's this one? The ureter? The urinary bladder and the urethra. And it goes down to your private parts. But with the kidney, one on your left and one on your right, I think it's up, right? Okay, so I'll look at it from the photo. Okay, so we have our kidneys here, one on the right and one on the left. And of course, you can it has a certain look, a healthy kidney versus a non-healthy kidney, I would take it. And the renal pelvis, what's that?
That's where the ureters, the kidneys make the urine, and the urine is collected in the pelvis and drained down the ureter into the bladder.
Okay, so it goes from the kidney down to the in this pelvis, right?
Yes.
The renal pelvis.
Yes.
And it flows down there
into the bladder.
into your bladder, where it says urinary.
By the ureters. The ureters are the tubes that lead from the kidney to the bladder.
Okay. Okay.
And then the urethra leads from the bladder to the outside.
Right. That's where you urinate.
Right.
But where in here do we? What malfunctions that causes the kidney disease?
Okay.
Is that appropriate way to put it?
The kidney disease is disease. The disease process is developed within the kidney tissue itself.
Okay.
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 Now, let me also say, for example, if you get blockages in the ureters, okay, that could cause backup pressure into the kidney.
I see.
And for example, if you have kidney stones,
Right.
you could have blockage. We end up with back pressure on the kidney tissue and damage to the kidney.
I see.
If you have the ureters run in the what we call the retroperitoneal area in the back. If you
In
have
the back.
cancer,
Oh, so that's why they say if you have a kidney problem, you feel it in your back of your right side?
no, we got both sides, so you
Oh,
can
that's
be
right,
the
both
side.
sides. That's right, that's right, that's right.
Now,
That's right.
if
But you
if
can't,
if
you can't survive with one kidney, right?
Yes, you can.
Okay.
Yeah.
Okay.
If you have any disease that is in the retroperitoneal area that causes obstruction to your ureters, then you can also develop kidney problems from that as well.
Oh, I see.
Now,
And
if
at
you
what?
got infections,
Okay.
infections in the kidney as well can lead to damage to the kidney tissue
Okay.
itself and kidney disease as well.
So any kind of damage to the kidney resulting in kidney disease puts the person on dialysis.
If it's severe enough. If it's severe
Oh,
enough.
it has to be.
Yeah.
Yes.
You can function, just like you said, you can function with one kidney. You can function without dialysis with 20-25% of your kidney. Once you get below 15% function,
Okay.
then you start thinking of dialysis.
Also, and that's why you have that test. Is it the GFR?
The GFR,
That
exactly.
measures the percentage of your
Exactly.
kidney. Okay. I
And-
want to open the lines, Doctor. 773-3337. But this whole scenario here, can it be avoided, or once it starts in progress, it's just going to eventually end up in the kidney disease?
It depends on the process. If you have an infection that results in kidney damage, and the infection is treated, you can arrest progression of the disease, and you might lose. Let's say you may have 40% of your kidney function or 50% of your kidney function lost,
Okay.
but it doesn't get any worse. On the other hand, diabetes is a continually progressive disease that will damage your kidney progressively. And if you were to live long enough, despite the best treatments, if you live long enough with diabetes, for example, you would eventually end up with probably requiring dialysis. There are treatments that we do to prevent and slow the process,
Like what?
of the medications. This sort of thing, controlling your blood sugar, treating anemia, which is associated with kidney disease, this sort of thing. But if you do those things, your chances are good that you will live a reasonably healthy life. However, if you live long enough, I mean,
Inevitably, that's
could
where
happen. Exactly.
it happens.
And I can add, too, about urinary tract infection. And I want to add this little piece because many times we have patients that come into the hospital and they'll say, I just got a urinary tract infection, or I just started having pain. But when we actually do a urinalysis, we can kind of tell how long that person has had a urinary tract infection. And many times it's pretty severe. So they've had that increased pressure when they voided. They've had, a lot of times they've seen that the urine is tinged with blood and haven't gone and done anything until it's gotten so bad. And in some cases, we've had to admit in the hospital patients that have had urinary tract infections when that should be taken care of in a doctor's office. You shouldn't have to be admitted into the hospital.
Right, shouldn't. So, because a urinary tract infection is kind of like routine.
Yeah.
So
you should be able to.
I don't know.
should be.
I never like the word routine.
Yeah,
but-
Well, I say routine, I mean like.
but it's not uncommon.
It's fairly common. It's
Yeah.
like, and it's very standard to treat it and give you and even drink cranberry juices or whatever. It doesn't seem like it's something made, but what you're saying is if you don't treat it and address it appropriately, it could lead to something else, basically, like anything else, right? Now, how does our lifestyles contribute to all of this in terms of our eating habits, our nutrition, our exercise? How does all of those things tie into these things?
Well, I'll add the part about water. I'm just going to say about water, and especially since I live in Florida. Many times when I talk to groups about drinking water, you would think I said, I'm just going to say eat dirt or something, because they get such I don't want to drink water, and you need to drink water.
But is it really necessity to drink like these 8 glasses or 8 whatever? I mean, it sounds like almost too much.
Yeah. No. I get asked that questions all the time. There's no.
Okay, I got to take this call. It's coming from Tortola, so let's take it in. But I want to hear your answer, okay? Hello, good evening. Hello, good evening.
Good afternoon.
Hi.
Good evening.
Good evening. I can hear you.
Yeah.
Go ahead.
In this, I'm watching this program that you have on the television with this kidney problem that you're talking about.
Yes.
And it's a similar thing that happened to me the other night I want to tell you about.
Go ahead real quickly. I'm listening. We're listening.
The other night I was sleeping in the night, and I feel a pain. I feel a pain down by my side. A terrible pain. It woke me up. I couldn't sleep for the rest of the night. And I went to the bathroom to pee, and when I went into the bathroom to pee, I had a blockage, like the pee stopped suddenly. And I had a nurse friend, and I called her and I told her what happened to me. And she said I must go down to the hospital. I went down to the hospital, and when I went down there, I was checking by the reception to see the doctor. And I feel like I want to pee again. And I went into a bathroom there, was peeing. And it couldn't come. The pee wouldn't come. It was such a blockage where it gives me such a pain. And then upon a sudden now, it just feel like something just fly out. And when we still go to the doctor and tell him what really happened and things, and then the doctor tell me that it passed out itself. I want to know if there is any problem that developed. Right now, if I'm peeing right now, sometimes it feels like the pee not coming out like how it should really come out.
Okay.
Like something is still there. You can tell me what should I do or something?
How old are you, sir?
How old are you, caller?
I'm 48. I'm 48 years of age now.
Okay.
Well, I don't want to be...
First.
Okay. All right, but what you can do is because where are you calling from? Tortola. Okay, what I'm going to do is we're going to hang up and then you listen, okay? But make sure you follow up with your doctor. Please do. Alrighty, so he just has a concern. I guess he just wanted, your take on his experience.
I don't want to making diagnosis.
Yeah, of course not.
Right?
Of course not.
But it sounds there are a couple of possibilities. One is that he has prostate obstructive disease from a prostate problem, which is why he can't pee, or which is why he starts peeing and suddenly stops. So his prostate.
But he
may
said
be
it felt like something flew out.
Well,
I was thinking kidney stone.
That was exactly. That's not a bad thought. That was the other possibility.
Okay.
But the fact is, he said he continued to have it. Even after that.
Even after that.
So
okay.
it could have been a kidney stone. It could have been a blood clot that was there.
So would you suggest? I don't know if the gentleman from Tortola. Thank you for calling, sir. Has a doctor or a clinic or somewhere where he can actually go.
I would strongly recommend that he sees a urologist.
A urologist.
Yeah. And that would be where I would start. Yeah.
Okay. So the specialist, sir, is called a urologist, and he will or she will be able to assist you in making the correct diagnosis, because I guess at this point that's what he needs, right? Is a diagnosis as soon as possible.
Right. And intervention.
And intervention. Okay. And so, as we were saying, you were telling me something really quickly, and I kind of had to cut you off.
Okay. Yes.
What was it?
But the question I
water.
get all the time about eight
Yeah.
glasses of water.
8 glasses of water, and they're talking about
Okay.
10 ounces. And
Look, I am not aware. I'm not aware of any prescription that says you have to have X amount of water in the course of a day. The body's a remarkable organism, and it tells you when you're thirsty. If you drink when you're
Yeah, your
thirsty,
lips get parched,
if
your
you
tongue
drink
is
when you're
dry.
thirsty, or you feel, and you don't even get that far. If you feel like drinking water,
You
or
drink.
drink is that you drink something. Your body will tell you what your needs are.
But maybe, Doctor, why they say that, instead of water, they pick up the Coke and the Pepsi and other fluids,
Yeah.
which is not the same as water.
And
Well, I'll even challenge that as well. I mean, fluids are fluids, and
Well, you
and
see, I think I've heard that, but is that it's not
Sugar.
the same
It's
because
so
there's
much
all different.
sugar.
The
Yeah,
water
well,
is
you
get-
natural
because
and
we
it's
got some
pure, and
people
it's-
that-
guess
That's
what?
a
With the
diff-
water, there's no calories.
that's a different situation. Now we're mixing out, you know.
And doesn't the water flush your system out? So some people have
Because we
a
got
glowing
peop-
skin,
yeah.
healthier skin, because they're not drinking Coca-Cola and
Because
all
we got
of the,
some people that only drink Coke. I have a handful of people that I know
Right?
only
And
drink
the
Coke.
water, I understand, flushes your
Flushes you.
system out and kind of give you the bright, glowing,
Skin.
healthy
It
glow
does
on your
good for your
skin, and it
skin.
does a lot of benefits as opposed to drinking the sodas and the stuff that has no
Tea and the
nutritional
coffee. Well,
value to it.
Tea is good, but the coffee and we have
I
to
guess
watch
with the
the
caffeine,
coffee.
because maybe the Coke and the coffee and the stuff, they crave the caffeine.
Because when you get a cup of coffee at Starbucks or any of the coffee shops, that's not just one cup of coffee. That's 4 cups of coffee.
Okay, so you Starbucks lovers, you hear that?
That's 4 cups of coffee. That's
Really?
equivalent to 4 cups of coffee.
Why? Because of the potency?
Mhm.
No wonder you like Starbucks. Uh-huh. Okay, yeah. Oh gosh, she touched somebody's nerve. But she's just telling you like it is, And I'm so glad, Stephanie, you're able to come and join us, because I think, we just want to have the opportunity to share these types of things with each other and really let our people here realize the importance of these issues. But I want to make sure before we leave, we talk about our lifestyle. Here in the Virgin Islands, I don't know how it is in Gainesville. I mean, I went to law school at the University of Florida, which is where you went as well. But how do they eat?
Gainesville is a lot of Southern cooking.
A lot of Southern cooking.
A lot of Southern cooking. We have a lot of healthy restaurants there, and we also have an initiative to go to the farmers market and get fresh fruits and vegetables.
So is your initiative like on promoting healthy eating, for
Yes.
example?
But unfortunately, because of the lifestyle of busyness, we have
grab and go.
Yeah.
And here in the islands, in our territory, we eat a lot of starches in one sitting. So you had one of our local restaurants today, and you enjoyed that. But our lunch plate, for example, would have at least 3 starches, because you got your rice, you got your
Corn,
mac and cheese, you
you
got your stuffing, and I could go on, yeah. And then you got whatever your meat is, and you got your. It's a full plate. Well, you saw one of those plates today. Stephanie ate part and took the rest back with her, But nonetheless, I take it that we need to adjust our eating habits.
No question about that. And we alluded to that earlier when we talked about the epidemic of diabetes. When you have this kind of a high carbohydrate diet, if you have it, first of all, it leads to obesity. Obesity uncovers diabetes, even if it's latent. And diabetes leads to a whole bunch of other things. We talk about kidney disease, but there's also peripheral vascular disease. There's also blindness. There's a lot of complications of diabetes.
Loss of limbs.
Loss of limbs, and even going on. So.
Right. So changing our eating habits, meaning we get a balance of the 4 food groups.
Well, you want, I think how they kind of talked about it, it's twice as many vegetables. When you look at your plate,
It's supposed to be bright
you
colors
should
on your
have
plate.
like two things of vegetables, 1 starch, and a nice sized piece of meat.
Your protein or what have you, or your fish.
Fish
what have
or
you. Yeah.
But
I
you
guess
should-
that's kind of hard for vegans and vegetarians and people who just don't do that protein. So they have to do extra precautions to get the protein through beans and other sources, right?
Right.
Okay, good, good, good. And then what we have next?
And then you got the exercise,
Exercise.
which is a dirty word.
Exercise. But exercise doesn't mean getting up 4 o'clock in the morning and going to the gym.
No.
It doesn't mean taking out a membership in a gym. It means being active, getting out there walking, doing some sort of sports, doing some kind of activity for about 30 minutes or so per day.
Taking the stairs. If you're going to a place and you need to park, you
Yeah,
can park
you
a little
walk.
farther away. And
If you're going,
Are you reading? No, you're absolutely right. No, I'm just being facetious.
if you go into the 4th floor, you walk up the steps and you don't take the elevator. Yeah, yeah.
unless you have luggage.
Like you did, right? But nonetheless, I think so. The 3 things would be your diet, your exercise,
It's also important to get a lot of rest, and a good night's
and
sleep.
a good night's sleep.
Yeah.
Because doesn't doctors, you said that, I strongly believe that your body naturally heals itself and it naturally protects itself in terms of if your immune system is working the way it's supposed to, a lot of diseases and tumors and different things are actually fought off by
But-
your body's own natural defenses because
That
that's
is
how
correct.
it was created.
That is correct. However, that same body is being abused every day by pollutants in the air, foods that are not good, and on and on and on. So that the body's ability to continue to do that and do that well
breaking
is
down?
compromised.
I see.
And we get people that don't sleep enough, or they wake up in the middle of the night. And part of that is our busy lifestyle. People not going to bed till midnight and having to get up at 5 a.m. and really only getting like 4 hours of sleep because you don't immediately go to sleep. And so,
Right.
you need some restful. You need some restful sleep.
And
But
the
I call
base
it
is like
restful
8
sleep.
hours of restful sleep.
Yeah.
Right?
Not the.
Well, I don't know. I get a little bit nervous when I get those kind of prescriptions. It has to be 8 hours. Your body knows what it needs.
Yeah, that's
But
true. Everybody's body is different. Some
but
can
you
work
gotta
better with less.
give
and some
yourself
more.
the time
Because in your sleep is when your body replenishes itself.
Correct.
Right? So you do need to have that sufficient amount of time for your body to do what it's supposed to do nightly or whenever, because you may be working shifts or what have you. But let's take another call. Hello, good evening. Hello, good evening.
Hello.
You got to turn your set down, but you're on.
Yeah, my set is down, Esquire.
Okay, go
Counsel,
ahead.
Good evening.
Good evening.
I just want to say a pleasant good evening to you and your panel guests.
Thank you.
Attorney Natalie,
Yes.
I want to applaud you for raising the issue with this thing about these prostate. I think some of these men, that plain men, need to realize that their life is at stake when they don't take that test when they reach the age of 40. Natalie, I'm a personal friend of yours. We haven't seen each other for a while. You're beautiful on television.
Okay, thank you.
I also want to applaud your guest. I hope she will stay in the Virgin Islands, probably work with Dr.
We
Gardner.
would love to keep her here.
Because I'm looking at her finger. It seems like she's not married, so Dr. Gardner could hire her in your office.
I have some really observant viewers, and Stephanie is single. But yes, Paula, go right ahead.
No, but what I'm saying on the serious side is the fact that when I had reached the age of 40, I'm now past that. It was a funny feeling. Because when I went to San Juan to see my physician to get my test done, and I do it on a normal basis, and they check you for everything, it's a serious thing that when you reach that age, you have to get a test done, because when it's far gone, you're in more of a desperate, what am I going to do? My life is at stake. What is, the family to worry about?
Exactly.
What I'm trying to say is that when I did that, and the doctor did his incision in my rectum, yes, from a man point of view, having it done by another man, but you know what? I blocked my mind, and I said, hey, I need to live longer. I have a family.
Right.
And when the doctor did what he did, it's like, yes, it was a funny feeling. And then after what he did, and I realized while he was examining me, the way how he did it in my rectum and the area he was feeling, then he explained to me in layman terms the reason why he did how he did it, how it's actually the prostate grows on the inner part of your rectum, and that's where they find the symptoms. And if he does it that way at an early stage, you have a better chance of living longer. There was a rumor being said by some coworkers of mine that there's an incision, and I will pose this question to Dr. Gardner. Is it true that you can have this test done through your penis with, I guess they use a hose or something like that?
Okay.
So I just want to raise that question to Dr. Gardner. Again, I think your panel is doing a marvelous job.
Thank you.
I drink a lot of water. I never heard anything you have to do so much water, but I want to applaud you on your, on your guests from America. Nice to be in the Virgin Islands, and I know you enjoy the local food, especially from Dr. Gardner. But keep up the good work. I just wanted to raise that question to Dr. Gardner. Again, have a pleasant evening. Counsel, take care of yourself.
Okay, you too. Thanks for calling. I appreciate the call. And he does have a question for you, Dr. Gardner. But that was enlightening. So for you young men, and I'm surrounded by all young men in this studio. The crew in this studio are all male. There's not a female in this studio at the crew. And I'm sure they get those annual exams done. And like the young man who just called in said, I'm glad that he called in and explained his experience, and to let you know it's really not as bad as you think it is, but it could save your life or your father's life or your brother's life or your uncle or your husband's life or your loved one's life. So get it done. But he does have a question for you about where else you can get this test done.
Yeah.
And I want to take another call, so tell us real quick.
Okay, quickly. The test that you are alluding to is what might be called a cystoscopy. That's done by the urologist. Again, Dr. Graham will have some more to say about that when he comes on.
I'll have Dr. Graham on for the next part of the Men's Health series, but yeah. Okay, so it can be done.
It can be done.
Okay,
but that's not necessarily looking for prostate enlargement. It's looking for other problems in the bladder and
other
urethra.
problems. Okay, got it. Hello, good evening. Hello, good evening. Okay, I think I lost those couple of calls, but I think I have a few more minutes left that you guys can call back. But yeah, I'm so glad that he called, that caller, and said what he said, because he took it, he said, as early as 40, I think that's what he said,
yeah.
or right after. But the point is, the earlier you do it, I guess it's...
Well, it's usually it's not you're not expected to do it before until
40,
you're 40.
Right.
There are always exceptions, and if you have a history or family history
in your
of something,
family,
then you need to probably pay attention to that.
Okay. Excellent.
And we can add a too about the family history. A lot of times people really don't know what's going on in their family, so I encourage people when they have family gatherings, family reunions, not that you pry into each other's business, but start talking.
Right.
Because the first thing that the physician asks you, do you have a history?
Yeah.
And many times we don't talk to each other.
Because we don't know. That's a good point. Hello, good evening.
Hello, good evening. Does that doctor
No, you got to put
the Virgin Islands?
you got to put your TV down. I can hear myself.
Okay, sorry.
Okay. Yes, Dr. Gardner. Tell her how she could.
Yeah, does that doctor work in the Virgin Islands?
Okay, is that your question?
Yes.
Okay, thanks. Thanks for your call, Doctor. Do you work in the Virgin Islands?
Yes, I do. My office is in Gallows Bay. Could I give my telephone number?
Sure.
Yes. I could be reached at 773-3227.
Okay. 773-3227, and he's at the Caribbean Kidney Center here. So let's take another, right in Gallows Bay in St. Croix. Okay, so, we talked, I guess you joined us a little late, caller, but at the Caribbean Kidney Center, we were talking about the things that they do there, including dialysis for patients with kidney disease. Right? And so, in addition, Stephanie, who's visiting from Gainesville, Florida, has a newsletter. And that's how we hooked up. I really enjoy her health newsletter because there's a lot of tips and a lot of health tidbits and a lot of very interesting stuff in it that really caught my eye and caught my interest. And I think that the more educated we are about our health, the better off we are. So I want to give kudos to you because I think it's great, it's excellent, and I'm glad that I met you, and I'm glad that you came to the Virgin Islands, and hopefully this won't be your last trip.
It won't.
And of course, hopefully you get a chance to see the
She's going to be hired
rest
by me, remember?
She got herself a job already in the Virgin Islands, so it's all good. But I just really wanted to, and the reason why I wanted to have a part 2 series, and I'll have Stephanie. She'll be gone, but we'll pre-tape it. Involved with Dr. Graham on that issue with men's health, is because it's just so important. We're losing our men for reasons that we really don't need to, and so we really need to pay attention to that. And talking tonight about promoting healthy lifestyles, I looked at the kidney health education, and what the doctor here does is because, like he said, one of the 2 biggest medical problems that we have in the territory among particularly the black population is the high blood pressure and the diabetes. And so our local doctors are seeing more and more incidences, and probably even at earlier ages than in the past, right?
Correct.
And that's why we thought it was really important to enlighten the public. So caller from Tortola, thank you, and don't forget, get to a doctor, and if you don't have a family physician, just go see a general doctor.
Well, he should really see a urologist.
That's right, you could go see a urologist. At your point, based on what you explained, and the doctor heard you earlier on, you probably need to see a urologist. And if you do want to speak to Dr. Gardner here in St. Croix, again, you can call him at 773-3227. Dr. Gardner is at the Caribbean Kidney Center right here in St. Croix. And so, with our last-minute closing, first of all, I want to thank both of you. Thank you for being here. I think there was a lot. And sometimes when we have shows with so much information, the viewers prefer to listen. And I appreciate that, because the more we know, the more empowered that we are. But what we need to be doing is finding ways for prevention and avoid treatment. Not that we want to put you out of business, doctor, but, if we can stay healthy,
quite frankly, I welcome being put out of business.
then we don't have to go through those things. But the other thing is, I also want to ask you to please question your doctor. Don't just take what they say and swallow it and then get home and try to figure out, well, what was he talking about? Don't be afraid. It's your body. It's your health. Ask the questions you need. If you get nervous, what do they call it? White coat hypertension. Write it down and ask the doctor when you get there, or take your wife, husband, whoever with you to the doctor's office to help you out. So I hope that this show was enlightening to all of you who watch, and I thank you, dedicated viewers, for watching every week. Remember, who God bless, no man cursed. Thank you for watching, and I'll see you next week right here on WTJX, Channel 12. See ya.